Our exploration today focuses on these two sides of our pelvis, the ilium bones. And these two sides of the pelvis, as we walk, they should do a little bit of counter movement. And sometimes our low back creates a lot of discomfort or pain when they get stuck. Maybe they get stuck both rotated forward or both rotated back, or one rotated forward and one back is generally more common. So the exercise I want to share with you today is taking that pattern of walking and what our sides of our pelvis do when we walk and bringing it in so it's a lot more subtle. And as we're doing this, we're looking at the relationship of the joints in the back, these sacroiliac joints that you will feel as you begin to move your pelvis, and the pubic bone joints in front, and also then how the knee and the femur bone is responding to the movement here in your pelvis. So let's try this. We're going to come down onto your back and bend your knees and get cozy comfortable here so that you feel your body is well supported. Maybe you need a pillow for your head. And the action that we're going to do is simply moving one knee forward, and notice what happens with the movement of your sides of your pelvis, and then release that knee back, and then move the opposite knee forward. So it's as if the knees are walking forward. Maybe you feel like you have a little wire on the front of your knee. Someone's pulling that knee forward. So as my knee is pulled forward, this side of my lower back and pelvis may come off the mat just a little bit. It may not much for you, depending on your structure. So keep alternating and then begin to pay attention to the opposite side hip or lower back or that sacroiliac joint opening. This is what we want to pay attention to. As one knee comes forward, that opposite side joint in our lower back is trying to open a bit. And notice what you notice or sense in your own body about how that is opening. Sometimes those joints in the back get very stuck and held. And this movement, concentrating on the opposite side, can really begin to feel a subtle and gentle release of those joints, which allows for more freedom in the lower back and in the pelvis. So you can do this as long as it feels good. If it feels really comfortable in one position, then pause there and allow your body to sink into that comfort, to feel the structure releasing, the joints softening, and then when you're ready, gently come out of that. And then continue with that kind of knee walking back and forth to give your pelvis a bit of re-education of how, as you walk forward, one side of your pelvis rolls back as the other comes forward, kind of mirroring here what's happening in the rolling of these two sides of my pelvis. Now, if that gets very confusing, simply bring your pelvis in and roll the pelvis back, and then roll the pelvis forward, as we may have practiced in other videos. This is a great beginner move to begin to feel that relationship of the movement of the pelvis to the thighs, the legs, and also the lower back. And then begin to continue to explore yourself. You may find other movement there that feels really comfortable. Stick with that. Let your brain recognize that and begin to feel the ease that is coming through to hopefully help alleviate some of that lower back pain. Thanks for joining me today.